Hello, everyone. I am Dr. Lucky Cuenza, and I am one of the social media editors of the Journal of the Asian Pacific Society of Cardiology. Today, we have a very special guest. He's Prof. K.K. Yeo. He is a senior consultant cardiologist at the National Heart Center, Singapore, and he is the editor-in-chief of the Journal of the Asian Pacific Society of Cardiology, and he will talk to us today about the journal.
Thanks, Lucky. It's great that we have a chance to chat about the Journal of the APSC. So I think the APSC, is an organization that represents the professional cardiologists here within the Asia Pacific. And with the Journal of the APSC, what we really want to do is to bring the science, the cardiology science, the cardiovascular science generated from within this region to the people and to the medical professionals in this part of the world. I think there are a few key aspects that we want to highlight. First, arising from the APSC, we have several consensus statements spearheaded by our past president, Professor Jack Tan. And many of these consensus documents represent the collective insights and practice patterns here within the Asia Pacific. And this is really important because sometimes we may not have access to all the technologies that are available, and the practice patterns are also influenced by geographical as well as cultural aspects within our societies. So having a practice guideline or consensus document really helps guide our community here of cardiovascular practitioners in terms of what is best and most appropriate for our patients. The other part, which I think is of interest to our readership here, is in terms of national data. So we provide a forum for the scientists, the cardiovascular experts, both cardiologists as well as cardiac surgeons, pharmacists, and the whole range of cardiovascular experts in this part of the world to share some of the data from their respective countries. And this is really important because it is crucial that we get to publish about what our national statistics are. And this may include things like, AMI outcomes, heart failure practice patterns, cardiac surgical outcomes as examples. Well, thanks very much again, Lucky. I think we are very early in our in the journey for the Journal of the APSC. It's my privilege and honor to be able to be its chief editor. But frankly, a lot of the work is done by our esteemed editorial board that comes across the whole spread of the countries within the Asia Pacific. I'm ably supported by three deputy editors, Drs. Junior Ako, Dr. K.W. Park, Dr. Derek Chu, as well as two associate editors, Drs. Jonathan Yap and Alan Fong. Where do I see us going? I think our goal is to get ourselves indexed in PubMed and to achieve an impact factor. And we are well on our way to that. In fact, we have lots of papers. Our biggest challenge is to make sure that the papers come from across the region. We want to have a good representation, and I strongly encourage all our colleagues in this part of the world to generously write to the Journal of the APSC. I think there are already many papers with what I call science that is new, that is investigational papers, and these I think going to be crucial for the journal. What do I mean by new science or investigational reports? It means that it's not just a review paper, it's not just a case report, but really randomized studies, cohort studies, and these are important because it represents the latest that can come out from within the Asia Pacific. So I strongly encourage our community here within the Asia Pacific to contribute with their new science. This is, of course, in addition to the national statistics that I hope will be published within the Journal of the APSC, as well as consensus documents, and hopefully practice guidelines as well. I think this then informs practice, and this is meaningful, impactful, and directly relevant to all of us within the Asia Pacific.